If a patient goes to your practice and they're currently wearing a denture, what are their options when it comes to dental implants?
Well, one of the options is that they get 2 implants or 3 implants on the bottom, some 4 implants on the top, and they take their dentures and these dentures they snap in and out.
Okay.
And the problem with those
because you don't like those, you say.
No, I don't like those because number one, you can't chew very well with them. You know, people will still come and tell me, Doc, the dentures are great, but you know, my food always gets caught between here and there. They are loose. They're still dentures. That's all I can tell you. They're just dentures.
All right.
You know, but people want that as an option, so we do present them. What I try to tell them is, listen, you have better options. You have better options to get full set of teeth that is fixed, that you can eat your peanuts, your grits, you can chew your steak. You don't have to ask your stomach to start chewing for you, and have be on a Metamucil every single day and have those antacids every single day. You don't have to do that. You should not be afraid of going out. You go to a party, your friends invite you, hey, let's go out for lunch, or let's go out to eat somewhere, and you have to think in your head, am I able to really chew this stuff, what is on the menu? So you have to pick and choose. And maybe you don't even go to the restaurant that doesn't have things that you can't chew.
Okay.
You know? So, I mean, there's a lot of issues. So when you give them,
so you do it in one day?
Yes.
That means a patient could come in.
Yes.
Get the imaging, do the consult. They could have no teeth, you say.
Yes.
And you could do an upper and lower set of teeth that don't come in and out.
Yes.
And they walk out with teeth.
That is correct.
Really?
Yes, and that is what most of the people are now going towards. A lot of my patients are now switching to this newer way because they want to be able to smile and eat and do their daily activities like they did before. And so they say, come and tell me, Dr. Panjali, can I have teeth on the day I leave? Of course you can. People have jobs to go to. They have, there are a lot of my patients who are working with the public every single day. And the first thing right off the bat they tell me is, I'm okay with everything, but I'm not going to walk here without the teeth. And I tell them, listen to me, I'll give you one step ahead. I'll give you teeth that you don't have to remove. How about that?
In one day?
In one day.
Okay, good. Now we should mention, you have a big center, 10,000 square foot implant center. All you do is implants.
That
you
is
teach
correct.
other dentists. And you do it all right there. Like the lab is there, everything's there.
Everything is
that why
right
you do it
there.
so quickly?
That is why we do so quickly, because we have all the tools available to us that we can have a patient in the morning, we can do the surgery, and in the afternoon, by late afternoon or early afternoon, their teeth are ready to go. And they have teeth and they walk out with new teeth in their mouth.
Is that right?
Yes.
Is that common?
It is.
Like you do that every day?
That's everyday dentistry. That is what I do every single day in this practice, because that's all we do. Like I said, we do implants and we do all fixed implants. I'm not a big fan of those dentures because you can't eat your food.
Out, you don't like.
Snap in, snap out. You can't taste your food. And a lot of my patients, they come back and tell me once they switch from their dentures to the fixed, they'll say, Doc, my food tasted a lot better this time after many, many years of eating that. I said, why? Did she use something different? No, my wife has been cooking the same food, but I never enjoyed it so much as I did this time.
Because the roof of the mouth is no longer covered.
The roof of the mouth is not covered.
Interesting.
And you can taste, they can taste it. It's not that plastic feeling in your mouth. You're not afraid that something that you bite or chew on is going to fall out of your mouth.
How old can you be to do this? You said 92-year-old you had?
Yes.
That instead of a denture, you gave them upper and lower fixed teeth.
That is correct. So age is not a factor.
That's not too old to do?
Absolutely not. We do this every
So you could have a little
day.
bit of arthritis or osteoporosis or be on a couple of medications and still do this?
Absolutely. We have patients who have, diabetes and they're very concerned about when they come to my practice for the consult. That is one of the things. They say, oh, I've got osteoporosis, I've got this. I said, listen, we have a way to do everything. We can go around things.
And you'll work with their medical doctor if you have to.
Absolutely.
Right? Okay.
We do all the time. We work in hand with the medical doctors. We sometimes have consultations, or we ask the patient to go back to the medical doctor, come back and get some reports from them. So we do our due diligence to make sure that these patients are great candidates for getting fixed teeth in a day.
So no more dentures.
No more dentures, absolutely. They should not be worn, like I told you. Dentures are a no-no, absolutely a no-no in my practice because of a lot of reasons. They're clumsy, they're slammy, they don't fit right. They should not be worn, like I tell you. They are so traumatic, not both psychologically. And let me tell you, Randy, that patients who have dentures, they may seem happy to you.
They just adapt to it?
They just adapt to it. But when I talk to, like I told you, one of my job is to listen to my patients. I listen to them very, very carefully.
And they say they can't eat.
They come and they start talking to me, and during that conversation, they tell me everything, how bad these dentures are. But they say, Doc, I never tell my wife about it because she'll be upset. Or the wife will tell, I never tell my husband about these things. He just wants me to be happy, and I just feel bad and I don't talk about this. But let me tell you something, when these people who have been wearing dentures for years and years and years together, when they get a fixed set of teeth, it's a life-changing experience, not just life-changing. Their whole living, the way they live,
self-esteem changes.
Their self-esteem,
their charisma changes.
Laughing, they're doing. I have a patient who plays a trumpet in the church, in the local church, and as soon as he would put the trumpet in his mouth, his dentures will fall out, and he cannot do it. He is 78 years of age. Okay. But when he came to me, he says, I play at the church every now and then. Do you think I'll be able to play the trumpet with it? I said, absolutely. Why not?
So brand new upper and lower set of teeth.
Brand new set of teeth.
No problem with the trumpet.
Play your heart out every single day. And I see him off and on coming in for the cleaning appointments now, and he's so happy. He tells me he always comes there. And there's another lady who comes in. She was sick and tired of her dentures. She came to me, and she is about 78 or 79, if I remember correctly. And she came up to me, and her name is Linda, very nice, wonderful lady. And she says, can you give me something fixed? And I said, sure, I can. We did. I gave her a new set of teeth, and she brings me cookies every single time. She's just so grateful. And she says, I want to make cookies for you for the rest of my life because you have done something that nobody else has been able to. She says, every time I come to your office, I am going to bake cookies for you. So this is the amount, it's just life-changing experience for these patients. I can go on and on and on about all the patient stories.
So free consultation, they get to see you.
Yes.
How soon before you tell them, hey, we can do this?
I tell them that if you want to do it tomorrow, we can do it tomorrow.
And they'll get their teeth tomorrow?
Yes, they will get their teeth tomorrow.
But don't come in and out?
Absolutely.
Okay, good for you.
Yeah, and we can do it on the same day as well. We have a few patients who
come. If I flew to you from California to New York, and I said, hey, I'm on a time crunch, and let's say I have no teeth or I have a bunch of teeth that need to be removed.
Yes.
You're saying that you could remove those teeth, give me a fixed upper and lower teeth in that day?
That is correct.
Wow.
So you take a morning flight. We have patients who take a morning flight, and evening they go back home with new set of teeth in their mouth.